This is power Doppler. You can see that, we can see that in this kidney there's blood that is flowing, but we can't tell the direction in which the blood is flowing. It's just showing that the blood is flowing. So this is power Doppler. Power Doppler just shows that there's blood flow, but it cannot distinguish an artery and a vein. We also have got the 3D and 4D ultrasound. So 3D, multiple 2D planes acquired via mechanical or matrix array transducers and reconstructed into a volume, allows multiplanar reformatting and surface rendering. So 4D real-time, 3D as time dimension. So the difference basically between a 3D and a 4D is a 3D is a static image that you can acquire, whereas the 4D now is a video or a moving a motion. It shows a small image that is moving. So I will show you how the difference, or in the next slide. So applications of statics, fetal phase anomalies, cardiology, volumetric ejection fraction, gynecology, interventional guidance. So we are saying that when you are now doing the profile of the scanning, you want to check the cleft lip palate, of static applications, we use a 3D, 4D technology better. Advantage is better spatial understanding of volume measurements. So disadvantage is lower temporal resolution, especially 3D, more processing time needed, artifacts from motion. So these are some of the disadvantages of using 3D and 4D ultrasound technology. So this is a typical 3D image. So you can see this is a static image there, but when this image starts to move like that, now it becomes a 4D. That's the difference. So a 3D is a static image like that, and you can visualize the face of the baby nicely. You can see the lips there and the nose, the eyes there, and you can see that there's no cleft lip and palate there. This is the advantage of 3D and 4D. We also have what is called the tissue harmonic imaging. So the principle uses harmonic frequencies, multiples of the fundamental transmitted frequency generated by a nonlinear propagation through tissue, receives at 2 times the frequency second harmonic. So what we call harmonic imaging, your transducer has got a certain frequency that it is producing the signal. So the tissue itself can multiply the frequency by multiples of 2, 3, 4, like that. So those secondary frequencies now are what are called the harmonics. So harmonic imaging is an advantage that it can reduce the artifacts and it can make pathology clear. So that's how this technology works like. So advantage is reducing artifacts, side lobes, reverberation, improves contrast in lateral resolution, better signal to noise in obese patients or deeper structures. I'm going to show you the next slide how this technology has got an advantage. Uses routine B mode enhancement in abdominal and cardiac imaging. So let's see here the tissue harmonic imaging. So this is the primary signal that you can see there that is sent, the initial frequency that we send from the machine. Then the received frequency now, when the tissue receives this, the frequency is going to generate its own secondary frequency, which is called harmonic. So this is 2 times the primary frequency. So this is called the harmonic frequency. Because the frequency now is changed. It's now 2 times. So we are going to have a different type of a waveform like that. So here is the application of tissue harmonic imaging. You can see this is the heart there. So you can see it's a little bit darker, the heart. It's not very clear. But when you use the second harmonic, you can see that it's getting clearer like that. We've multiplied the frequency through tissue harmonic. So it becomes better. Again, look at the left lobe of the liver here. You can see that it's a little bit bright. So when I'm using the second harmonic now, we will see that it is now appearing very clear and you can visualize it better like that. So also with contrast enhanced ultrasound, which is called CEUS, uses microbubble contrast agents, gas filled stabilized shells injected via IV. So this is just like the contrast that you do when you're doing your CT and the MRIs. Special harmonic or pulse sequences, pulse invasion amplitude modulation to enhance bubble signals while suppressing tissue. So applications, liver lesion characterization, vascularity assessment, cardiac perfusion, trauma, e.g. solid organ injury. Advantage is real-time perfusion imaging, no radiation, nephrotoxicity, unlike CT, MRI, or contrast. So let's look at this image that is generated using contrast enhanced ultrasound. So you can see this is a 2D image of the lesion there. It's not a very clear depiction of this liver lesion there, but when you use And now the contrast enhanced ultrasound, you can see the lesion that is hypoechoic there. You can see it depicted very nicely on contrast enhanced ultrasound. So this is one of the excellent technology that we have in recent times that can actually enable us to see pathology better. So also we've got this application which is called ultrasound elastography. So it measures tissue stiffness, elasticity. So we are saying that different tissue have got different stiffness. So because of their densities. So this technology is used especially in those soft tissue which are mostly homogeneous. Let's take for instance the breast tissue, which we say is almost homogeneous. So we expect that the tissue or the deformation, if you put compression, is supposed to be almost the same or homogeneous. But when there's a mass or lesion, let's say there's cancer there, because the cancer cells, they've got different density and stiffness, they're going to deform differently. So the different deformations are the ones that we use now to distinguish a normal and abnormal pathology. Strain elastography, manual compression display is relative stiffness, color map, shear elastography, e.g. RFI, generates shear waves and measures propagation speed, stiffer tissue, faster speed, quantitative assessment. So we have got different types also, or types of tissue elastography. So this is not a standard application that you are going to use on a day-to-day basis. So some departments, they do have elastography. So in due course, I'm going to also be lecturing you on ultrasound elastography. So applications of ultrasound elastography: liver fibrosis staging, breast thyroid nodule, characterization, prostate, and musculoskeletal applications. So this is ultrasound elastography. You can see this is your normal B mode image there. So if you look here, you can see that we have applied ultrasound elastography, and you can see that the different colors there. There is your blue, your red, your green, different colors. So these colors are conferred by the different deformation characters of the tissue or the stiffness when you compress using a probe. So they compress differently. So that's when you get the different colors like that. So that is the technology that we use in ultrasound elastography. So other advanced techniques, we offer the compound spatial imaging, steers beam from multiple angles to reduce artifacts. So some of these, they are inbuilt within your systems, so you don't really have to control them. So we also with panoramic view, this one you can adjust it on the knowledge. I will show you that when you do the actual practical sessions. So extended field of view by stitching. We also with the speckle tracing, tracks tissue motion for strain analysis, e.g. myocardial deformation. So general consideration across modes. So this will be the last of our presentation. So this we've discussed already. So just a recap on this. So the transducers, we would linear, high frequency superficial, curvilinear, abdominal, phase array, cardiac, and endocavitary. So artifacts, we discussed about the artifacts in the previous lecture. Artifacts, shadowing, enhancement, reverberation, mirror image, aliasing, Doppler, safety, no ionizing radiation, ALARA principle for thermal and mechanical indices, especially obstetrics. So knowledge, adjust frequency, higher, better resolution, less penetration, gain, focus, dynamic range, and persistence. So in the next lecture, we are going to be discussing ultrasound knowledge. So these modes are often combined, e.g. B mode with the color Doppler overlay, which is duplex, B plus spectral Doppler for comprehensive evaluation. Modern machines allow seamless switching and simultaneous display. So we are saying that when you're using these ultrasound imaging modes, at times you don't use them in isolation. You combine your B mode with the color Doppler with the pulse, so you can combine them. So, ladies and gentlemen, this brings us to the end of this lecture. I hope you are appreciating. If you have any questions, don't forget to just put a comment section, or if you need any improvements or any areas that you feel they need more clarity, just put in the comment section in the comment section of the video below. Remember to subscribe for more insightful lectures which are coming. Thank you so much.